Our next speaker is a graduate of Rutgers University, where he studied cell biology and neuroscience with a minor in religion and psychology. It was there that he was exposed to the various philosophies and traditions that serve as the basis of his talk. He will continue to ask questions and ponder the nature of our existence as he moves on to Temple University for his general surgery residency. Please welcome Patrick McGovern, class of 2013.
Is it working? Okay. A little higher? How's that? Good? Okay. Hi, guys. My name is Pat. The name of my talk is Medicine Against Suffering. I'd like to start out with a quote. One of the professors that we have here, Bruce Fisher, said during my orientation that medicine is the greatest profession there ever was. Now, is that because we keep people from dying, or is it because we help people and we serve people when they need us most, in their most dire times of need? Many people, throughout the ages, since the dawn of time, have been struggling with this idea of suffering, the human condition. Why do we suffer? All things like that. Tonight, I'd like to ask you some of those same questions and to go through some of the things that those that have come before us have come to realize about suffering, and hopefully use it in the end to take better care of our patients. This right here is a dentist drill, which many people consider to be torture, but luckily we're not talking about dentistry tonight. So for me, there's two types of suffering. The first would be physical suffering, or suffering that you can really see and experience on a physical level. Say, for example, you go off to war and you lose all of your limbs. I imagine losing your limbs would be a very painful experience, and something that you would certainly feel on a physical level. You also have psychological suffering, though. People have profound suffering because they're either depressed or terrible things happen to them that cause them to have very psychological pain. And you would think that the two of these are exclusive because they're somewhat different. But if you think about it, are they really? You can have very real physical suffering that gives you profound psychological pain. Think about the soldier who's come back from war and who has lost their limbs. Are they suffering more because of the physical pain of losing their limbs, or are they suffering because of the profound sense of loss that they feel, not being able to use their limbs like they used to? On the contrary, what about someone who has a profound psychosomatic disorder, somebody who has a psychological disorder, who causes them very real, chronic, intractable pain that doesn't necessarily have anything that can be seen within their physical selves that's wrong, but still gives them a very profound amount of pain and suffering? So you have to think and you have to wonder, if the two of them are linked in some sort of way, can they have a common solution? Can there be something that we can do to end suffering at a more basic level that goes even below physical versus psychological suffering? And of course, this is the central question of our existence. Why are we here? Why do we suffer the way that we do? What's the purpose of all of it? It's not a question that I think will ever be answered. I don't think that we ever will know, except maybe, when the end of the world comes, why we're all suffering. But it is something that we need to ask ourselves and we need to pursue, because the journey in itself gives us so much information, so much valuable information that we know about ourselves, and enables us to take better care of our patients. And so one of the people that asked himself this question was Siddhartha Gautama, otherwise known as the Buddha. He lived about 2,500 years ago in India, and he actually grew up inside a palace until he was an adolescent, where he was protected from the outside world and knew nothing of suffering. He didn't know what it was. He didn't know that people could actually suffer because he was protected by his father in this palace. And when he actually escaped the palace as a teenager, he saw for the first time people who were starving, people who were suffering from profound illnesses, and he was horrified, and he didn't know what to make of it. So he spent a lot of time thinking, and he actually ended up living an ascetic lifestyle for some time, and went through a very profound journey himself. And at the end of it, through much meditation and through much thought, he decided that, or not decided, but he came to the conclusion that we as humans suffer because we desire. We have desires that may be unrealistic, like the desire to not experience pain in this life. Or we have desires for material things that we really shouldn't desire, like money or power. And if you could eliminate these desires, you could eliminate suffering itself. The question Christians often ask themselves is suffering something you can avoid, or is suffering something that you should avoid? In the Christian tradition especially, is it something that you can avoid if God himself had to suffer death on the cross? One of the central teachings of Christianity is that Christ wants you to take up your own cross and follow him. Not saying that we're meant to suffer and God enjoys the fact that we suffer, but there's good that can come from that suffering. Could we really experience love if we were not able to be there for each other in each other's sufferings? Would our relationships have the same meaning if we could not give of ourselves when our friends needed it most? Would we have free will if we could not freely choose to make sacrifices for one another? All questions that are very worth asking. And again, I don't know that there would be an answer for it. But we as physicians have decided to give of ourselves in the service of our patients. And we do so through the discipline of medicine. But why medicine? Why have we chosen medicine? For me, it's the perfect combination of the discipline of science with compassion and humanity. It gives us all the tools that we need to approach suffering and the human condition from every angle, from every aspect we can. And we know from Hippocrates that we've taken an oath to prescribe medications for the good of our patients and do no harm. It would be easy, it would be nice if things were that simple. We know that medicine has tons of ambiguity and that nothing is that straightforward. We know that the things that we prescribe for our patients, the interventions that we use, cannot have the greatest outcomes sometimes. They can actually end up hurting our patients, sometimes even killing our patients. How do you rectify that with our oath that we've taken, the oath of Hippocrates, which says that we will do no harm? So I really wanted to put a picture of Yoda from Star Wars up here, but when I emailed the powers that be at Lucasfilm, they said more or less that I'd probably get sued. So we'll have to imagine that this is his home on the planet Dagobah. But the reason I bring him up is that Star Wars was profoundly influenced by Eastern philosophy and Eastern tradition. And Yoda says that you must do or do not. There is no try. There's nothing in between. You have to give of yourself fully and completely, pour your heart, mind, and soul into taking care of your patients. Well, how can you do that if you know that what you're going to be doing might end up hurting them in the end? Yoda says also, earlier in the movies, that you have to be able to let go of everything you fear to lose. Again, how can you let go when you need to pour your entire heart, mind, body, and soul into it? If we look to the Hindu tradition, the god Krishna has an answer for us. Krishna was a god depicted in the Bhagavad Gita, or one of the very popular epics within the Indian tradition, which depicts a great war between two warring factions within a family. And there's a warrior, Arjuna, who's about to enter this great battle, who's very conflicted because he knows that once he enters the battle, if he wins, he will have killed many of his own family and friends. And if he loses, he'll suffer death. And so he doesn't know what to do, to the point of where he doesn't want to enter the battle. He doesn't want to act. And so Krishna gives him this advice. He says, either you will be killed on the battlefield and attain the heavenly planets, or you will conquer and enjoy the earthly kingdom. Therefore, get up and fight with determination. What he's essentially saying is that you have a duty to act. You have a duty to prosecute this war because you have the capability and you have the weapons. Don't be concerned with the outcome of the war. Don't be too attached to the fruits of your actions, because eventually, you have a duty to act. And that's what you must focus on. Everything else will work itself out in the end. Similarly, for medicine, we have a duty to act. We have the capability, the technology to help our patients, to ease their suffering. And we must do it regardless of what happens in the end. That's not to say that we can't care and we can't mind when our interventions end up not having positive outcomes. But we need to realize that our effort is there, our good intention is there, and that the doctor-patient relationship itself is strong enough to help our patients get over their suffering, regardless of whether or not we achieve the outcomes that we want to. So my next question is, can we actually transcend our fate or our earthly existence? Can we go beyond into what some of the religions speak of, like the afterlife or resurrection and stuff like that? The religions of the world say, yes, of course you can, or else they wouldn't be around. They wouldn't be in business like they have been. And the way that they do that is, getting back to Buddhism, talking about the topic of Nirvana, Nirvana is sort of the Buddha-like state that he spoke of, that you can reach through meditation, that you can eventually reach a state where you've completely surrendered everything, not just desire, but you surrender everything to a point of not even existing yourself. And that really would be the optimal state, or how you can avoid suffering and transcend this world. In Christianity, of course, it talks about the topic of salvation and resurrection, saying that love, both for one another and love of God, is what enables us to triumph over sin and death. And then if we talk about moksha, or the concept of escaping the cycle of reincarnation within Hinduism, that really focuses on realizing the divine within yourself and realizing your connection to the rest of the universe. And once you realize that you too have this great connection to everything else around you, then you too can escape from this cycle, and you can escape this earthly world here. A lot of this seems like stuff that wouldn't really necessarily be applicable to us now, especially here in medicine, the scientific discipline of medicine. What can all this mean? But if you look to Elizabeth Kubler-Ross's model of the stages of grief, and you look to the final stage of acceptance, I would argue that the stage of acceptance represents principles that are contained within these ancient ideals. If you look at Nirvana, patients do, even though they may be dealing with profound illness, profound loss, they can reach a state where they no longer desire to live longer than maybe that they can, or they no longer possess a desire to be without pain, and they can use it for their benefit. They also have their suffering and pain eased tremendously by experiencing the love of their friends and the love of their family, just like in the Christian tradition. So much so that death is triumphed over, and that this love, this experience of love, almost makes it worthwhile to have to go through something as terrible as a painful death. And even for moksha, people find meaning, they find purpose, they find their connection to the universe. They see the good in the sufferings that they may have to go through, and they realize its greater purpose in their lives and in the lives of others, very much like the principle of moksha, where you realize your connection to the outside world. But what about the dark side? The religion of Taoism, or another ancient Eastern Asian religion, often speaks of the ideas of dualism or duality, that for every force in this world, there's a necessary opposing force. So, can light exist without darkness? Can life itself exist without death? When you look at these dualities, you have to ask yourself, in our own lives, can suffering, or can solace and comfort really exist without suffering and death? Duality says no. That's sort of disconcerting, knowing that, we may never reach a point, for all of our scientific advances, for all of our knowledge, for all of our power, that even though we may be able to heal our patients, will they ever really truly be without suffering? Will we ever be able to overcome this duality? I don't know the answer to that question. It's something to think about. But what we do have is hope that the wisdom of the ancients can give us the tools that we need to make a difference for our patients now. How do we do that? The Buddha tells us that we can help our patients let go of the things that they cling to in this world and overcome their sufferings. Christ says that patients get extreme comfort from the love and affection that they get from their friends and family, and from the doctor-patient relationship. We know that Hippocrates tells us that medicine is the best tool to confront suffering in this world. Yoda says that we need to give our full effort, even if we think it's going to be futile. Krishna says not to worry, even if it's futile, because you're doing your duty, and eventually, in the end, all things will work out. And from Taoism, Lao Tzu, the founder of Taoism, we know that even though we all face death, death is the very thing that allows us to experience the wonder that we call life. So I hope that you guys continue to ask yourselves these questions, continue this journey. Never be disheartened by the answers that you may think you find. Always continue it yourself, and always look for truth. And I guarantee that you'll be able to take better care of your patients. Thank you.